Now we're going to talk about acid-base, and this is going to be an introduction topic to the acid-base regulation. We can say that the clinical importance of acid-base regulation is to maintain an optimal pH, or a physiological pH, which is from 7.35 to 7.45, in order to maintain adequate functioning of biological processes and the enzymatic function. So we can see here that the normal pH, or physiological pH, is between 7.35 and 7.45. Life happens to be compatible between a pH of 6.8 and 7.8, and these are considered extreme measures of pH. And we can look at pH as being a concentration of hydrogen ions within the solution. And we can see here that at a pH of roughly 6.8, the hydrogen ion concentration is approximately 158 nanoequivalents per liter. Compared to a pH, as it increases from 6.8 to 6.9 all the way up to 7.7, we can say that the pH at 7.7 has a hydrogen ion concentration of approximately 20 nanoequivalents per liter. So we can think of pH as a representation of the hydrogen ion concentration within a particular solution. So here we saw a scale from 6.8 to 7.7, and that shows how tightly regulated the body regulates the hydrogen ion concentration. Like we said, 6.8 to 7.7 is on a small scale here. And we said that the life basically exists between 6.8 and 7.8, human life, which are extreme measures, but the body does its best to try to regulate a pH between 7.35 and 7.45. So if we were to say that the pH less than 7.35 implies a higher hydrogen ion concentration within solution, it's considered to be an acidotic environment. And a pH that's greater than 7.45 implies a lower concentration of hydrogen ion concentration and therefore an alkalotic environment. So here we discuss acidosis and alkalosis, and two primary processes that can create acidosis are respiratory acidosis and metabolic acidosis. Likewise, two primary processes that can create alkalosis are metabolic alkalosis and respiratory alkalosis. And we'll talk about this chart in more detail in the following lectures, in which we'll look at things in greater detail as far as the primary process and the compensatory mechanism, or the compensation, in hopes to try to bring the pH always back close to 7.35 to 7.45. So we'll talk about the systemic manifestations of acidosis and alkalosis. And here we divided this graph into the left side being the acidotic environment, and on the right side we can say the alkalotic environment and its effects on the organ systems. So we'll start off talking about acidosis. In acidosis, for example, respiratory acidosis has an effect on the neurophysiology in the sense that increased PaCO2, the partial pressure of carbon dioxide, that occurs with respiratory acidosis, as is shown here, depicted in the graph here. In respiratory acidosis, you have an increased partial pressure of carbon dioxide that can occur, for example, through hypoventilation, in which you're not blowing off your carbon dioxide through the lungs. This can increase your cerebral blood flow and therefore increase your intracranial pressure. So if you have a patient, for example, a trauma patient that comes in, and they're in hypoventilation and experienced a closed head injury, you want to make sure that they're not hypoventilating, which increases their cerebral blood flow and would worsen their increased intracranial pressure and perhaps may lead to brain herniation. Also, the acidosis involves the oxygen dissociation curve, and as we know, that creates a right shift. And the right shift implies that there's an increased affinity of oxygen towards the hemoglobin molecule within a red blood cell, and therefore it binds tightly and not released to the peripheral tissue and may lead to tissue ischemia or hypoxia in the periphery. Likewise, acidosis may create a direct cardiodepressant effect on the heart muscle, and therefore you can have a decreased contractility of the heart, as well as a decreased vascular smooth muscle tone. That implies vasodilatation. So if you were to look at the hemodynamics, you can say that with decreased contractility and a decreased systemic vascular resistance, you're ultimately going to get a decreased mean arterial pressure, and therefore may lead to decreased perfusion pressures to your vital organism and may experience hypoxia. Okay, also in an acidotic environment, the catecholamines that are released from the adrenal glands are less responsive, or in fact the heart is less responsive to, for example, norepinephrine, epinephrine, and cortisol that's released from the adrenal glands in an acidotic environment. So even though there's stress hormones being released from the adrenal glands, in an acidotic environment, the heart becomes less sensitive to these catecholamines and therefore has a decreased cardiac contractile force. Likewise, in an acidotic environment, you can have electrolyte imbalance. For example, you can have hyperkalemia that takes place in acidosis, so that you have an increased potassium concentration. And we talked about this in the cardiac physiology, how potassium has a strong role in the cardiac physiology as far as generating the action potential that ultimately generates a signal for contractility within the heart tissue. So therefore, when you have an imbalance of potassium physiology, we can say that there becomes a disorganization that may manifest itself in ventricular fibrillation. So these are the acidotic manifestations that take place within the organ system. And likewise, we can say that alkalosis has almost the opposite effects on the organ systems. For example, in alkalosis, that affects the cerebral blood flow in the sense that if you had respiratory alkalosis, for example, a patient hyperventilating, they're anxious and they're breathing too fast, you can say that the partial pressure of carbon dioxide is decreased, and we can say that with the decreased carbon dioxide partial pressure, you're going to decrease your cerebral blood flow, and it's almost a one-to-one relationship in the sense that for every decreased partial pressure or 1 millimeter decreased partial pressure of carbon dioxide, it decreases the cerebral blood flow by 1 ml per minute. So for example, if you had a partial pressure of carbon dioxide at 40, a normal partial pressure of carbon dioxide, and a normal cerebral blood flow approximately 750 mLs per minute, if you were to half that, for example, during respiratory alkalosis where you're hyperventilating, and now your partial pressure of carbon dioxide is approximately 20, which is half the normal, 40, you may decrease your cerebral blood flow by about half, from 750 to 375 mLs of blood going to the brain per minute, and therefore the patient may suffer from cerebral ischemia. Likewise, if you were to look at the oxygen dissociation curve, you can say that alkalosis creates a left shift, and therefore oxygen binds less readily to the hemoglobin molecule, and therefore it's released more easily. Likewise, you can say that in an alkalonic environment, you have a decrease in pulmonary vascular resistance, opposed to the increased pulmonary vascular resistance that you would sustain in an acidotic environment. And an increased pulmonary vascular resistance would put more strain on the right heart as it's pumping blood from the right ventricle into the pulmonary artery in order to get oxygenated within the lung tissue. And you can say that for a patient who's in right hearted failure, that extra resistance that has to be pumped against by the right ventricle may put the patient in right hearted failure, in which the patient would experience peripheral edema in right hearted failure. Going back to alkalosis, you can say that in an alkalotic environment, bronchoconstriction can take place. You can have coronary vasospasm, cardiodepressant effects, and an increased systemic vascular resistance. In the next lectures, we'll talk about more in detail the primary processes of respiratory acidosis, respiratory alkalosis, and the metabolic processes of acidosis and metabolic alkalosis.